Thank you, Mr. Chairman. Before we begin today's hearing, which marks the beginning of a series of hearings on competition in the healthcare marketplace, I think it would be helpful to clarify 2 points of overriding concern. First, healthcare is not provided in a true free market and has not been provided in a free market since at least the onset of major government intervention in the market through Medicare and Medicaid. Second, healthcare as a service is unique in that nearly every person in America will require some medical treatment over the course of their lives. Health insurance is not like fire insurance or car insurance, where there is a hope that one will never have to use it. Medical costs inevitably occur, and hopefully insurance or some funds set aside for these costs will be used when the time comes. In the face of these facts, that the healthcare market is not a fully free market and that Americans have no choice but to participate in the market, it is essential that we preserve as much competition and freedom in the overall healthcare marketplace as we can. We should strive to enact laws that foster competition so that prices are checked, patients have choices, and the premium quality of American healthcare can be maintained. Otherwise, costs will go up, choices will narrow, and quality will be diminished. That is simply the laws of economics at work. In 2010, President Obama signed into law the Patient Protection and Affordable Care Act, which I believe is antithetical to competition. Rather than promoting free markets, Obamacare put in place a regulatory structure that stifled competition and instituted incentives for increased market consolidation. Since the enactment of Obamacare, I have been sounding the alarm bells. The Judiciary Committee held hearings on Obamacare and competition in each of the last 2 congressional sessions. I am pleased that the committee meets again to continue to sound the siren and supplement the growing record of Obamacare's anti-competitive results. One of the principal tenets of economics is that competition can lead to lower prices, enhanced product variety, greater innovation, and downward pressure on costs. When markets consolidate, there exists the potential for reduced competition, resulting in the contraction of the related benefits. Of course, consolidation does not always lead to a reduction in competition. Market efficiencies can be obtained, and the expansion of successful products can be achieved more rapidly through transactions. However, when non-market and government forces compel consolidation, those underlying forces and their effects should be closely examined. Accordingly, it is vitally important that antitrust laws are properly and consistently enforced to prevent anti-competitive consolidation and conduct, and that laws that promote these activities are subject to strict and ongoing scrutiny. Continuous and vigilant oversight, such as today's hearing, will help to ensure that healthcare markets operate as freely and competitively as possible in order to provide consumers with premier and affordable health care. I look forward to the testimony of our witnesses on the state of competition in the predominant healthcare markets. And thank you, Mr. Chairman. I yield back.